Let's go to Kyle Hoath now. He's the president of the AMA here in WA. The AMA have done a hospital health check survey. 56% of respondents, so this is from young doctors, trainee doctors in particular, reported moderate to high burnout. That's up 4% from the previous 12 months. G'day, Kyle. How are you?
Good, thanks. How are you?
Yeah, well, thanks. I've got a nephew who's a trainee doctor, and if he filled in the survey, he'd say, yeah, it's really busy. I'm under the pump. I'm sleep deprived. And I don't know whether he's typical of young trainee doctors. What do you make of the survey results?
Yeah, I think he is typical from those sort of disclosures. We're hearing more and more, and this looking at over 1,300 of our junior and training doctors in the state are reporting that it's a pretty tough gig for them at the moment. To see that number of burnout climb from last year is a bit of a concern. I mean, not overly surprised given the pretty tough winter that we've had, and knowing that there's still a fair bit of work to go in before we can improve working conditions for our junior doctors, but concerning definitely.
Kyle, if I asked a trainee doctor 30 years ago, 20 years ago, 10 years ago, would they have all said the same thing? And I ask this with great respect. Is it just part of becoming a doctor, being put through the ringer?
I think we are seeing a bit of a change where the expansion of the role and the growth of our population isn't being matched by the workforce. We sort of add to that the layers of bureaucracy and form filling and extra work that gets put onto particularly our junior and doctor in training. It is a different role to what it was 10, 20 years ago. So yeah, I think we are seeing a change in what they're expected to do and what conditions they're expected to operate under, rather than it being I think a change in the way it's perceived. If you go to an ED,
or if you go, an ED and then you require a bed, there's no one more important than the doctor is there, and being able to see him and getting that attention. They're the most important person in the world when you need them. Is it because of what's happening in front of the glass has changed, Kyle? Because the way society and community is that the issue?
Slight correction. I mean, I think the doctors are absolutely essential and are equally the most important person. You certainly don't want to not have a doctor when you rock up to ED, but I would never say they're the most important. I still think our nursing and admin and paramedic staff are equally as essential. But it is a bit of a team game, health, right? People bring their expertise and what they're there for.
Very much so.
I wouldn't want to be in an ambulance without a paramedic, and I wouldn't want to be in ED without a good nurse or doctor.
Yeah. I understand that, but I guess ultimately it's the doctor who will make a decision what happens to you, and I'm not disparaging the other professions, but I guess my question is it's what's happening out on the road, out on the street, on the other side of the glass? Is that what's impacting on them?
To a degree. I think that's what we're seeing with ramping as well, right? Like the patients are more complex, which makes the job tougher and means that patients often require a lot more in regards to intervention or the type of decisions required that make it harder to do the job, if you like. The other and relatively concerning part, I think, is that it's not just from other staff that doctors in training report discrimination and harassment, but harassment in particular is often coming from patients or from family members.
Yep.
Which is, we've talked a little bit about this in recent weeks, but it's sort of unacceptable. This is their workplaces, and they're there to help people, live, to keep people well, and shouldn't have to put up with abuse.
Absolutely not. So, Kyle, from here, what will the health minister say to you? I imagine you have a reasonable relationship with her and the other three of them, but what happens from here? How do you get this on the table in front of the minister?
Yeah, look, one of the reasons we make an effort to make sure the hospital health check is well presented every year is that we do get good engagement from the minister, from the Department of Health, and from each individual hospital that we report on as well. Last year, every hospital plus minister plus department engaged us in sitting down with some of our DIT representatives, some of our industrial staff, and myself to go through to go through the findings specific to their hospital even, and to look at strategies around how can we improve the hotspots, I guess, or the issues that are coming up the strongest in the survey, to try and improve. And year on year, it's been a better experience in terms of the engagement we've received. And so we had fairly good engagement last year, and early indications are, I've already had quite a few hospitals already reach out and respond, and both the Minister's office and the DG have reached out similarly and are keen to engage us on this. So, look, credit where credit's due. It is taken seriously, and I thank them for that. But there is a pretty big body of work here to be done in terms of making sure the future of our workforce, our future doctors are staying in the profession, are looked after from a wellbeing point of view, and are given the opportunity to contribute to medicine, contribute to the health of our community. Yeah,
no doubt. Couldn't agree more. Kyle, what can a minister or even any resourcing, financial resourcing, hospital designs, what can a system do about poor behaviour by the community?
Yeah, that's definitely a tough one. But we see in many sectors that we have a zero tolerance, and I guess good public awareness and advertising of that, whether it be at in the ED, if you like, or whether it be a bit more of a public campaign. We've been through similar things with police, with our paramedics, and with teachers. These are not the workers or the environments in which people should be exposed to that kind of behaviour. So look, I think that's a tough one, but would be keen to work with the people who know better than me around how we best get that message out there.
Yeah, for sure. Oh, well, you'll have our backing on it. It's absolutely not okay. Kyle, I always enjoy our chats. Thanks for your time this morning.
Likewise, mate. Thank you.
Thank you. Kyle Hoath from the AMA WA. So 56% of trainee doctors are saying they're burnout, they're stressed, and a lot of that is to do with harassment from patients, from family members. And the workload's huge, the bureaucratic workload, the signing of forms, etc.